Hello, and welcome to the Cycle Endometriosis podcast, where we will delve deep into experiences, challenges, and triumphs of those navigating a life with endometriosis. Join us as we share the stories of resilience, offer insights from experts, and foster a community of support for those affected by this often misunderstood condition. Whether you're newly diagnosed, a seasoned warrior, or seeking understanding, I hope this podcast is here to help empower you and uplift you on your journey. Tune in as we break the silence, shatter stigmas, and amplify the voices of the endometriosis community. Medical disclaimer: this podcast is not intended for the purpose of providing medical advice. All information, content, and material of this podcast is for informational purposes only and is not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider. Thank you so much for being here, and now on to the show. Hello, everyone. Welcome to our guest, Skyler, who's on this episode of the Cycle Podcast. Skyler, thank you for joining us today. How are you?
Good. Thank you for having me. I really appreciate it.
We're very excited to hear from you and hear about your story and appreciate you coming on. But as I always do, I like to start with just telling us a little bit about yourself so we can get to know you.
Yeah, my name is Skyler, as you said. I'm 23 years old. I'm 24 in March. And I live in Florida. And I am a content creator for a living. So I do baking from home, which is really, really amazing. I love my job. I'm very passionate about cooking and baking and being in the kitchen. It really is my happy place. I love making food for others. It makes me happy and brings me joy. So that's my passion, and it happens to be my job too, which is the most amazing thing ever. It's not always been that way, so I'm really happy to say that. But my husband, I live with him in Florida, and I have some local family too. And yeah, that's about it about me.
Well, thank you for sharing. Do you have anything that's like your favorite to bake or make?
I love all things to do with bread. I love making sourdough. I love making bread loaves, but I also love like cinnamon bun type recipes, pastry type recipes. And I'm getting more into the complex things like croissants and a thing called a croquembouche. I don't know if anyone knows what that is, but it's like a tower of pastry that is constructed with caramel. I love the complexity of it, and it brings me joy to make it. It is so long. The process is like very daunting, but
Wow. Oh my gosh. Okay, I need to see a photo of that when that happens.
Yeah, I'll have to send it to you. I've made it once before on my account, but it's about time I try to do it again. Each time gets a little bit easier.
Oh my gosh, so fun. I mean, it kind of reminds me, it's not the same at all, but last time I was in Vegas for work at a convention, the cronut there is like so huge, the croissant donut. Have you ever made one of those?
I just made those 2 weeks ago.
You did? Okay.
Yeah.
We're all going to have to follow you on your social account to see all the amazing things you're making.
Oh yeah, oh my gosh, that one was really fun. It's the same process as a croissant, like all the layers, but then you just fry it. Yeah, it was so fun.
Oh my gosh. It sounds delicious. Okay, well, good. Well, let's chat about endo, or just even your story and what happened and when things kind of started for you, or when you first noticed something was off.
Mm-hmm. So when my period started, I was 12 years old, and I really didn't have any red flags, I'd say. My period was painful though, like not super painful. It wasn't stay from home sort of painful, but it was like your friends talk about it, and everyone has a little bit of pain with your period. So you're like, oh, okay, like that's fine. It was very heavy though. So I talked to my mom about that for a couple years from like 12 to 13. And I was like, hey, like, I don't know if it's supposed to be this heavy, but I was able to live a normal life. I went to school, never stayed home. And around 14 years old, my friends were all getting on birth control, and they were saying, hey, this helped me a lot with my periods. Like, I don't really feel symptoms anymore that much. So I talked to my mom about it, and thankfully my mom's she's open to anything if it's going to help me and my health. So she was like, oh, let's go to the OBGYN. Let's talk to them. I know you're young, but why not? So we went and we talked to them. They were like, yeah, a lot of people your age are getting on birth control. It's really common. So let's just put you on it. So I was on birth control for a while, on and off, and until my 20s, I was on birth control. But I did have very bad side effects with birth control. So I was on it on and off because I would have different symptoms with each one. So with the pill, I had really bad retinal migraines. So I don't know if you're familiar, Melissa, with retinal migraines, but it's where you have an aura in one or both eyes, and it's really difficult to see. And then you might have the onset of the migraine before, during, or after the aura. For me, it was afterwards. So that was when I was like, I wasn't even in high school yet, I don't think. I was 14.
Oh my gosh.
I'm at cheer practice in middle school. Like, what is happening? Like, felt so sick. There was one time where I vomited from having a retinal migraine. Like, they were intense. So for a while, we didn't understand that it was birth control. But once I was on and off of it, we realized, okay, I can't be on a combined pill. I can't be on ones with estrogen. So I went to the next Planon. Yeah, right. Interesting.
Very
I know.
interesting once find out that you have endo. But yeah, wow. How scary too at such a young age. So for listeners who might not know, what happens? So maybe people who are having these migraines, they don't know. Like what does it feel like?
Oh, yeah. It's the first time it happened, it was really eerie to me because I've worn contacts for a while. So I just figured one of my contacts was messing up. So I'm just thinking, like, what is this spot? It looks weird. But for me, what happened was it would start as a very small spot in the corner of my eye. Sometimes it was triggered by bright light, and the spot would grow and grow and grow until my entire one eye was like just out of
Couldn't
commission.
see.
So I
Wow.
always, at first, I had no idea the migraine was going to come after that.
Sure.
So I was at school, felt sick, and then I had got the migraine and was like, Mom, I have to leave school.
Yeah.
But then I was able to get used to that routine of how it
Right.
presented itself. So then I was
Right.
able to say, okay, I know what's happening. Now's time to figure out how to get home and how to be in bed to where when this migraine hits, I'm laying down. I was
Yeah.
even put on migraine medication for a little bit, but that had side effects too. So I was
Yeah.
just like, I'm not even at that age. I was not sexually active, and I was like, it's just worth it to get off of it
Yeah.
and try to balance that.
Sure. Okay. So what happened after you went off?
So I was on and off until my 20s. So I was on different birth controls. I was on Nexplanon. I also tried a different pill that was, I think it was just progesterone only. And in my 20s, that's when I had normal periods for about 2 years. I was married, so I got married when I was 19. So I was like, I'm married. I can be off birth control. It's really not a huge deal. I'm at a secure place in my life. So all my symptoms from birth control went away. I was able to lose some weight that I gained from birth control too, which was nice. So about 22 years old is where things started to get a little abnormal with my symptoms. So
Okay.
things were good for about 2 years off of birth control. And then I noticed some interesting things starting to happen. But the main red flag for me was I started to experience pelvic pain that I never had before. And that was the time that I really started to analyze myself and other symptoms that I was having. Because I think in life, we just tend to put things on the back burner. Like, I can't drink milk, it really hurts my stomach, but the doctors say I don't have any sensitivities, so no big deal, right?
Yeah.
So I had 3 specific instances at 23 years old, so this past year, that were 5 months within 5 months, and they were all an hour before starting my period. And it was absolutely excruciating pain across my lower front abdomen, and it radiated to my back. And when I say absolutely excruciating, I feel like those words don't even explain the type of pain that I experienced. It
Mhm.
was that red flag type of pain where you have this coming to moment, like something is not okay right now.
Yeah.
The first time that it happened, I thought, maybe I have an ovarian cyst that burst. My mom had ovarian cysts in the past. I thought, this is something that happens to women a lot. So I was laying on the couch in the fetal position. My husband's like, "We should go to the ER." And I'm like,
Yeah.
I'm stubborn. I'd rather swallow it back and lay there and deal with it. So that's what I did. And it eventually went away. And I just thought to myself, okay, that was weird. Maybe I'll eventually make a follow up with my OB because I could tell it wasn't my stomach. I could tell it was with reproductive in my
Yeah.
lower abdomen. So once the pain subsided, I was like, it's like I ran a marathon. I was so exhausted and I could barely function or do anything, which I think is very common with a lot of people with endo, right, Melissa? Yeah.
Yeah, for sure. I mean, it's like you're in so much pain that it's hard to like get at. I mean, the fatigue for me for sure would last several days after like having what I would consider what you had, like an episode.
Yeah.
The pain so severe, like you said, you can't even describe it. It's not even describe. It's a way over a 10, and
Yeah.
then I just feel like you're just so exhausted for like, at least for me, it would definitely be through like my whole cycle, like
Hmm.
struggling to
Yeah.
function.
Yeah. And I never even knew back then, of course, I didn't know it would be identified as a flare. But I agree. It's almost like you have the flu for the next few days. It's like you're very
Yeah,
tired, you're sluggish. It's like a hangover from the pain. It's very,
it
very weird.
is.
Yeah.
Yeah. Yeah,
Yeah,
I would
so that
describe
happened that first time, yeah. Oh,
and you're
sorry,
just
go
so
ahead.
no, no, no. I was just gonna say, and I say this often, but like it's like you're in cement too. It's like when people say tired, or it's not. It's like beyond tired. It's like heavy. I don't. That's the best way I can describe it.
Yeah, and I think too when you're experiencing that pain, at least for me, it's like you have an adrenaline rush to almost be able to
Hmm.
cope or deal with it. So I was even shaking afterwards. I had no
Hmm.
idea what just happened. And then once
Yeah.
you come down from that adrenaline, it's like you're
Yeah.
absolutely exhausted.
Yeah.
So yeah, a very eerie experience, that's for sure.
Yeah.
Yeah.
Okay, so you didn't go to the ER and you didn't feel well, but at that point, it was like the beginning, so you're just like this was just like a weird thing that happened. But then I'm assuming you're about to tell me it happened again the next month or the next 2 months away.
Yeah, so within the next couple months, I this is so random. Oh, actually, I was on my period this time. So not every instance happened an hour before my period, but that was a consistent trend. But the second time I was on my period, and I'm gonna get a little graphic, but you, Melissa and I talked before the podcast. That's just how it is with endo, and I'm gonna be raw and real because I wanted that education when I was trying to find a diagnosis. So I was on the first or second day of my period, and I had a tampon in, and I had such excruciating pain inside of my vagina. And I was like, I don't know what is happening right now. When I was sitting, I felt like I had to keep readjusting myself, and I was in such excruciating pain. But it was almost like sitting was making it worse. So I took the tampon out, and the pain was still there. And I was like, okay, so it wasn't the tampon. What's happening here? And now I was at the point where I wasn't necessarily dealing with the pain as good as I was the first time. I was crying, I was emotional, and I kind of emotionally lost it, which I think almost made the pain harder to manage. But the same thing, it happened for about 30 minutes to an hour. Time feels a lot longer when you're in a flare,
Yeah. Yeah.
but it lasted for that long, about 30 minutes to an hour. Once it passed, again, same exhaustion. And I was like, this is not okay. Something's going on. And I told myself, you have to remember this pain. You cannot minimize it for yourself. And you have to make an appointment with your OB.
Good for you. That's great. I mean, because sometimes it's hard when you get out of it. It's almost like you don't forget, but it doesn't seem as severe when you're like on the other side of that
Mhm.
pain. Yeah.
Yeah, or you have this internal dialogue almost where you're like, am I overreacting?
Wasn't that bad.
Yeah, am I just really just thinking about it too much? Was it really, really that bad? But every time I put myself back in that mindset of what it felt like when I was in that pain, that's when I truly realized, this is not okay. Like I have to go to my OB. Yeah. So I did make that appointment, and they set me up with a nurse practitioner, and this is my local OB that I've gone to for a long time. And so they set me up with the OB with the nurse practitioner first, talked to her, and basically she took me very seriously. She was like, I am so sorry this is happening to you. This is not normal. Let's schedule an ultrasound and then let's have a follow-up with the doctor. Okay. So I scheduled the ultrasound, and through this process, we found out that I have PCOS. But for me, that was just kind of like a bonus diagnosis because PCOS doesn't describe the pain. So I was like, okay, that's great and all, but I still don't have an answer to my root problem. So they also, in this ultrasound, found a cyst that appeared to be an endometrioma. So I talked about this with the NP, and she said it could be a hemorrhagic cyst or an endometrioma. They're not sure, and they want to monitor the cyst, and then they want me to follow up with the doctor then. So I followed up, and during this process, before the follow-up, I started to do my own research because I heard endometrioma, and I heard that first word endo. And I know someone that has endometriosis, so I was like, okay, let me do research on this. And I obviously found out that you can't have an endometrioma without having endometriosis. So I did a lot of research, and I found your podcast, Melissa. Aww. I listened to it a ton, which, not to put you on the spot, but amazing educational podcast. You helped me so much with really, really realistic experiences, and your own too, so that I could compare and realize, I'm not going crazy. But I also,
I did not pay her to say that, everyone. No, thank you. So it really thank you. That means so much. Thank you for saying that.
Of course. And the listeners know too, like they feel the same way. It's so beneficial. So thank you. But I also found Nancy's Nook, which everyone who has endo, I think, is familiar with Nancy's Nook. Very great educational for doctors to find, and then some other experiences. So I realized then that I really resonated with an endometriosis diagnosis because I realized that I had a ton of symptoms that were what I thought unrelated to endometriosis. And I think that's really recurrent for everyone. Yeah.
For sure. Can you tell us about some of those?
Of course. So some of these red flags for me is the number one that comes to mind is my entire life I've had very consistent dietary issues. I've been to doctors about it. I have done the vegan diet. I've cut out gluten. I've cut out dairy. Every single time I've cut something out, I still have these issues. They maybe get a little bit better, but they were still there and present. I did the blood test to see if you have any allergies. I've done everything and no answers. So I knew there, I was like, wait, endometriosis could explain all of these symptoms right there. Okay, first of all, very worth it to find a diagnosis now, right?
Yeah.
I also had very extreme fatigue. PCOS causes fatigue too, but I do notice now after my surgery that it was also partly endo. I had 8 to 9 day-long periods, so they were very long. And when I was off of birth control, they were very heavy. I also had cramping and diarrhea with ovulation. So that was something that I could pinpoint exactly when I was ovulating because I knew I was like, okay, like I can feel this. This is painful. I also, speaking of diarrhea, not to get graphic, but like all day long sometimes, I ate healthy, no reason. It's not like I was like going out and eating foods that I could say, oh yeah, that's why my stomach's upset. It was always, why is this happening? I've done everything right, And I was always gassy constantly. It's actually like a running joke in my family. Like Skyler's stomach's always upset.
Sorry to laugh, but it's funny because I get it.
Like, it's just so true. Like if you ask me, if you did before my surgery, you asked me on a random day, how's your stomach feel? Everyone's going to know I'm going to say awful.
I know. I was like, my stomach's a mess today.
Yeah.
Leave me alone. Yeah.
Gosh. Yeah. So Those were some. There's also some others too that were very consistent, especially towards the end right before my surgery. I had very intense lower stomach bloating. And now I know it's called endo belly, but it was so physically painful,
Yeah.
just protruding, and your pants don't fit, but the pain of the bloating itself is out of this world. And I could never, I tried cutting out foods, doing anything to make my bloating go away, working out more frequently, and it was still there no matter what.
Yeah.
I also had, and especially before, closer to my surgery, it increased a lot. I had mid to low back pain, and I specifically had it on one side of my back, the most painful on my left side. And it got to the point where every day before my surgery, I was in so much pain I couldn't stand because, as we talked about, my job's videography. So I, stand in a lot throughout the day to video. And I was having such a hard time. Every single cut, I'd have to go sit down, breathe, then try to stand back up and film again.
Yeah.
Thankfully, that was only for a couple months right before my surgery, but still, that was just big red flag for me. And throughout the years, I also had rectal bleeding, which I always would just say, oh, it's probably just a hemorrhoid or probably just, something unrelated. And
Mhm.
my family even told me sometimes, you should really go get that checked out. But I was like, hemorrhoids are common or whatever. But I never had that post surgery, and I had it very frequently prior, and sometimes an alarming amount of blood too. Which honestly, I look back and I'm like, gosh, Skyler, like really, you thought all this was normal? Oh.
Well, I mean, you can't, it's so hard because there's just so many different things. Like, oh, my stomach hurts. Maybe I ate something funny. It's hard to put it all together because the
Mhm.
lack of awareness, like we were talking about pre-show, is just, if there was more awareness where you knew all of these symptoms could contribute, then I do think it would be easier to be like, oh, maybe I have this endometriosis that's out there in the world that I've kind of heard of. But
Mhm.
when there's such a lack of awareness, I think it's hard to put it all together. So yeah, don't be so hard on yourself, because I think many of us have done that because it's so just different. Like, you just think, oh, my stomach hurts, I have a headache. You would never put it all together. Or I have a migraine. You never put it all together
Mhm.
because it is such a full body disease. But even what is out there doesn't say that, it's a
Mhm.
full body disease, as much as a lot of people do say that. It's just not very public. It's not
Uh-huh.
public knowledge.
Exactly. Exactly. And it really is all encompassing, right? Endometriosis, there's not a lot that it doesn't cause in symptoms.
Yeah.
So once you realize that and you come to terms with it, it's like, okay, there's some satisfaction there to know, like, I'm not going crazy and this is all explained by one thing. And
Yeah.
that's something that I experienced around this time, in this time frame, where I found Nancy's Nook and I'm awaiting my appointment with the doctor at my local OB. I
Mhm.
felt sort of some satisfaction, like, okay, I feel like maybe I can advocate for myself now. I understand all these symptoms are possibly related to this one thing. So
Yeah.
I went to this next appointment ready to advocate. I also had
Mhm.
some other symptoms too that I just want to mention really quick because they were very
Please.
consistent. Yeah. I had this one was occasional. I had occasional urinary frequency where I'd feel like I had nothing in my bladder, but I had to keep going. But non-related to a UTI, no burning, nothing like that, just like urinary frequency. But I had a very consistent pain slash stretching feeling that I can remember up to when I was like 14, 15, where at least I'd say 3 to 4 times a month, if I woke up in the morning with a really full bladder and I went pee, I would feel this pulling or pain sensation from my upper abdomen and belly button down to my lower pelvis, almost like a rubber band was attached. And it was the same pain that I had consistently, where I would know, okay, once you get up, you got to kind of be bent over a little bit. Within about 30 minutes, you'll be able to stand normally. And it was just like something consistent. But I never mentioned that to anyone because I was just like, normal life aches and pains. That's what we just pan it off to, right?
Yeah.
Yeah. Yep.
Wow. I mean, and that, first off, you describing your symptoms, I think, has been extremely helpful, be very helpful for the listeners. So thank you for that. And it's crazy that you say like a pulling or like a rubber band, right? Because then what we know about like adhesions and endo, that's kind of what it probably was feeling like for you.
Yeah, and now looking back, I'm not going to fast forward too much into my end of my story with surgery, but looking back, I can almost picture in my head that that must have been endometrial tissue, and it was even sometimes related to my cycle that would happen. So maybe it was tightening and not pulling
For
was
sure.
happening there. So it's
For
crazy the
sure.
things we can notice once we have a diagnosis.
Once you know, exactly,
Hmm.
because then it all starts to come together. Yeah,
Hmm.
it's almost like mind blowing. I hate to say that, but it is, because like you're just like, whoa, this was
Hmm.
all tied together. And like you said, once you get that diagnosis, or even just once you research it, like you said, and you get on something like Nancy's Nook, or even just some information, some of it on the internet's not accurate, but just having some of that knowledge it's incredible, because then all of a sudden all these things that you've been going through start to come together, and you're like,
Exactly.
whoa, this
It's
is all
like the
related.
puzzle. It's like the last piece. You
Yes.
found it, and yep.
Yes.
Yeah, so around this time, I had about 6 weeks in between the appointment with the ultrasound, and they found this potential endometrioma. And for that 6 weeks, they wanted to see if it grew, if it didn't, what happened to it, and if it ended up being hemorrhagic or an endometrioma. So during the 6 weeks, like I said, I was like all over Nancy's Nook. I was all over your podcast. I was doing research. But thankfully, because of your podcast and Nancy's Nook, I did do good, helpful research. I found really helpful people like you to get reliable sources and know that I need, if I'm going to go through with this and have a diagnosis, that my local OB was not the end stop there, that I needed to find an endometriosis excision specialist. So I went into this appointment really ready. I was convinced that this is what I had, and I wanted to express to her all my symptoms and really get across to her the pain I was experiencing. So I brought my husband this time, and my husband and my family were super supportive throughout the whole process. I'm not very verbal about things I experienced before because, again, we just say, okay, this is day to day. This happens sometimes.
Yeah.
Life
This is
sometimes has aches and
normal.
pains.
Yeah.
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 So once I expressed all this to him, he's like, okay, that's really concerning. I do want to come with you. Let's just see what she says. And so I went to the local OB. And I'm sitting down with her, and she comes in initially with a stack of paper, and she's looking through, and she rushes just straight to, yeah, so I see here that it said that you had a cyst. We've looked at it, and now your ultrasound you just had at this appointment, your follow-up ultrasound, it shows that this is a non-worrisome cyst. It hasn't grown. We think it's hemorrhagic, and so you should be good to go. So I'm sitting there like, I'm so sorry, but I don't want to be disrespectful, but I'm experiencing this pain still. And I feel like my symptoms, just to, make a note of this too, were very fast. They started to come on very quickly, which some people, I've heard, through your podcast too, that a lot of people have gradual symptoms. They'll increase gradually. I felt like turning 23, it was just like, boom, just straight up. Everything was going crazy inside of me. So
Yeah.
I felt strong to get this point across to her. So my husband is thinking, oh, at this time, oh, that's good. She said nothing's worrisome. Because of course he's thinking, oh, okay, that's amazing. Like, great news. But I'm thinking this explains nothing. So I said to her, I'm like, so what's my pain management plan? I am not sure what to do here. I was told that it was possibly an endometrioma. So I did some research on endometriosis, and I really think I may have it. And she did. She honestly seemed very bothered with the fact that I was wanting to continue the conversation. Like, she just wanted to kind of leave at that point.
Mm-hmm.
So maybe she was having a bad day, trying to be positive. But so she takes a basic history on me. And I tell her, what I told you guys, no pain up until this point, being 23, told her the symptoms I had. And she said, I actually think it's impossible you can have endometriosis because you haven't had any pain up until this point of being 23. And people who have endometriosis have pain when they are 13 or younger, around their first period. And when
Not true. Not
I
true,
know, not
everyone.
true. Yes, for all listeners, not true. And when those words came out of her mouth, I knew right then, this is time for me to go to someone else.
Yeah.
So I ask her, she's like, so I'm continuing with this. And she basically says, without saying it, what do you want me to do? So I'm like, can you at least please give me a physical examination? Like, see if there's any like red flags that you see that maybe I should, go further to another doctor. So she leaves the room. I look at my husband and I have tears in my eyes, and he, is trying to be positive. He's like, she said nothing's wrong. Like, that's so amazing. But I'm like, this is not okay. I know my body. I know something's not right. So she comes back in and does the physical examination. And she does this particular thing where she presses on the left side and then the right side. And she says, let me know if you experience pain. Let's just say I didn't have to let her know that I experienced pain. Even my husband was like, what is happening right now? Like, are you okay? It shot through, when she pressed like that, it shot all the way up through my abdomen. I was in excruciating pain. And I was just like, what is happening here? This is awful. So she stops the examination. She sits down and she says, yeah, so I think you have pelvic floor dysfunction. And I'm like, in my head, I'm like, okay, possibly, but that could possibly be caused by endometriosis. So she says, I'm going to refer you to a local physical therapist, and I want you to go to them really consistently, and then we'll see if your pain goes away. So I said, but for the meantime, what should I do? And she's like picking up her stuff already and leaving as I'm asking her this question. And she says, honestly, like, you should really take Advil. I'm really sorry that this happened to you. Like, this pain seems really difficult, but make sure you're taking Advil when it happens. Like, girl, Advil ain't gonna touch this.
My gosh.
I know.
At that point, though, like, you had come in with so much research, which was great, because if you hadn't, you would have probably just left and been like, okay, because you didn't, how would you know?
Exactly. And that's what makes me so sad about the amount of time it takes for people to get endometriosis diagnosis, because not a lot of people are like super anal crazy like me and go home and do a ton of research and figure out things for themselves. I understand going to the doctor and trusting what your doctor says, because they're the ones with the medical experience, right?
Yes.
So,
and the fact that they said endometrioma to you actually helped you, because a lot of times they won't. Like, I think I was told hemorrhagic a million times, and they were endometriomas every time. But the person who's looking at the data doesn't know the disease well enough to identify it. Because what if you had gone in there and they just said hemorrhagic? You would have been like, okay, you would have got the scan, you would have thought you were fine, until more pain, more pain, more pain.
Exactly.
And that's such a problem.
Exactly. And I'm really, really grateful that I told myself to get a second opinion. And thankfully I was able to talk to, it's my husband's cousin actually who has endometriosis. She's had, I don't want to put a number on it because I'm not exactly sure the number, but a lot of surgeries. And she's experienced a lot of pain over the years. So I knew she was someone I could ask. And I asked her, what should I do here? I feel like I'm at a loss. I'm really down in the dumps now because I feel like I've done everything I can and I've exhausted my options except for going somewhere else. And she encouraged me. She said, this is not normal. I also think you have endo and you need to advocate for yourself. Find a doctor on Nancy's Nook and look at the excision specialist list and find someone that's covered by your insurance and go to them. So I said, all right, I'll do it. So I called this office.
By the way. Perfect advice.
Perfect advice. If you aren't sure if you have endo, it's incredible to look at that list and still find a doctor to talk to. Yes. Because they're a lot more understanding and they're specialists in the area of endometriosis. So they can help you so much more than a local OB.
And I can't tell you how many people who I've even had on the show, but outside of the show, that have said their doctor told them they did not have endo, and they did.
Yep.
So
I know it's a sad reality. I hope and I think medicine is getting better, going in the right direction.
I think so.
But thankfully we have resources like Nancy's Nook to, find these surgeons really easy on a PDF list. It was right away. I found one in Jacksonville, which is an hour away from me. And I saw he was covered by my insurance, looked it up on my insurance website, called the next day. So
incredible.
Now, this is just really where the point of my story, it just makes me happy looking back. Because even the second that I called this office, it's Dr. Michael Fox's office. It's actually a reproductive and fertility clinic, but they specialize in endometriosis and excision. And all the doctors there are incredible. But I specifically went to Dr. Michael Fox. And even the second that I called and expressed that I was experiencing pain and what just happened at my local OB, the woman on the phone, I mean, she was just so sweet and so understanding and wanted me to come in so bad. It wasn't like she was trying to rush me off the phone. We probably spent an hour on the phone together. And
Wow.
yeah, she took a whole history. She's writing everything down. I did have to put down a deposit for the appointment, which honestly for me, I was ready to pay any amount of money
Sure.
just to get
Of
any
course.
sort of answer. Yeah.
Yeah.
Mhm. Yeah, so she was super, super sweet. And I knew right then I had a better feeling. I hung up off that phone very, very content. And even with how busy they are as an office, she was determined to find any cancellations to get me in as soon as possible. She did while I was on the phone. So I only had to wait 2 weeks to go in, which is really amazing for
Wow.
an endo specialist.
Wow. That's
Yeah.
fantastic.
It's just like everything was aligning perfectly. And I knew that this was going to be a better experience. I was really positive about it. So I went in and I spoke first. It came as kind of two different appointments in one appointment. First, I talked to their nurse practitioner there, and then I talked to Dr. Michael Fox. So I spoke to the nurse practitioner. She understood every single symptom, every single descriptive word I used. She would just be nodding her head and say, "Yes, I completely understand." And I told her my whole history. She didn't rush me through anything, not one little detail of it. She asked me questions. She was really intrigued. And then she told me at the end, "Yes, I do believe you have endo." She explained to me how, unfortunately, there's really not many tests before surgery to definitively say, yes, you have endo. So she said she can say she's 99% sure, but she can't say she's 100.
Right.
So then Dr.
Wow.
Michael Fox came in. She told him my entire history, and he remembered everything that she said. And if you're listening and you've been to Dr. Michael Fox, he is a little like softer spoken. And at first, when you first meet him, you may like be a little confused on his personality. But once you get to know him, I promise he's incredible. He's just like so calm in his demeanor, which is really great for his job. But he's so calm and he allows so many pauses that sometimes you're like, okay, like, but he's just so mellow. He's amazing. So he talked to me and he explained to me that excision surgery is the way to go. And he was like, let's get you scheduled for this, like now. So I'm sitting there and I'm like, we just went from my doctor telling me to take some Advil to now you want to cut me open and excise this. I'm like, let me go home and talk to my husband
Yeah.
and let's figure this out. And my husband was like the same thing because obviously we're newer to this endo world. So I'm thinking, oh my goodness, one extreme to the next. What am I supposed to do?
Yeah.
Yeah.
That's a lot. I mean, that's intense. That is very intense and such a short time period. It just kind of all got thrown at you at one time. Yeah.
Yeah. Yeah, exactly. So I thankfully was able to just look at all of my resources that I had and was like, okay, everyone's saying excision surgery is the way to go. And they've had really great success with it. And I was really grateful to understand that ablation was not the way to go because he also knows that too. He was explaining, I use none of those techniques. I excise exclusively. That's all I do. And so I was determined to make this appointment and I had some follow-ups with them too. And they scheduled my surgery. They told me my surgery, they could schedule it, I think this was in June, they could schedule it in July. And I was like, I think that's a little too soon for me to wrap my head around. Can we push it back a little bit? So we scheduled it for August 21st, 2023. So I had some waiting time, this waiting period. And I kind of want to talk about this because I think that a lot of other people who have endometriosis probably experience this, that there's imposter syndrome that we kind of talked about before. That if you are alone with yourself a little too long and you're not having a pain flare, you can really convince yourself that you are going crazy. So I asked myself all these questions like, is my pain really that bad for surgery? Am I sure I'm not overreacting? Like, do I really think surgery is necessary? Am I being a baby? So it's really hard to trust in something, an invisible disease that you cannot be diagnosed with until you're cut open. But if you're listening and you're going through this waiting period and you're confused, just know that you know your body, you know your symptoms, and it is a really difficult mind game. But if you think that there's something wrong, there probably is something wrong. So just trust in that. And I kept trying to tell myself that. It's easier said than done. But I kept that surgery date. My family was determined for me to keep the surgery date. They're like, you've come this far, you gotta follow through with it. So before surgery was difficult, but I was very determined once the time came because my symptoms got increasingly worse in the 2 months before surgery. So I had a new symptom that popped up where I was getting right thigh numbness. So I was getting like tingly, numb sensations about every other day down my thigh. And I heard actually someone on your podcast experience that. So I thought, okay, this could be, from endo too. So I was determined through all my symptoms getting worse, and especially the mid to low back pain that I talked about. That was when it was hard for me to stand and film. So I knew I had to keep the appointment. So I did, thankfully. And I was diagnosed with endometriosis. So they found stage 3 endo, and they found 2 inguinal hernias. So potentially
Wow.
on the physical examination that my local OB did, she may have been pressing on the 2 inguinal hernias that were painful. And I would love to hear from you, Melissa, too. I've heard that endo can cause inguinal hernias, possibly. I also did heavy weightlifting, so it could be related to that. But yeah.
Yeah, I unfortunately don't have the data on that. I don't know.
Yeah.
But if anyone is listening, I mean, feel free, let us know, send me a message, and then I'll definitely bring it up on another show. But yeah, I mean, that's just also contributing to the pain. Did they also find that endometrioma?
So they did, and it was an endometrioma. It was not a hemorrhagic cyst. Yep.
Yeah.
Yep. I also had, and I'd love to hear if you have heard of this, or I'm sure you have. I had retroperitoneal fibrosis involving the course of my ureters and pelvis. That's also what I was diagnosed with. And I had
And
a lot of colon lesions and bladder lesions, which explains a lot of the diarrhea, rectal bleeding, the bladder symptoms that I had. So, yeah, a lot of great explanations in my diagnosis.
yeah, I mean, as far as I know, and I'm not a medical professional, but like the fibrosis, I think can be, it's like almost like a scar tissue. And I think that it can come from just everything kind of being stuck together and in
Mm.
the disease down there. So, or in that part, like that sounds like that's like the back. I think that's probably potentially some of your back pain. Like that's what
Hmm.
it sounds like because I believe that's in the back.
Yeah, so he
So,
said a lot of it was on my left side, so it explains my mid to left back pain. Yeah.
is
Mhm.
that where the cyst was too?
Yeah, well, yes, and they found another left retroperitoneal cyst. So that was like a non-worrisome cyst, but he
Hmm.
removed it. Um, yeah, so a lot of things on the left side, though, that explains my left side back pain.
Yeah.
And the bladder and the colon endo made a ton of sense to me because that's
Hmm.
where a lot of my extreme symptoms were.
Yeah.
Uh, so especially during my post-op too, and I will say if you're scared of post-op, don't be. Flares are really bad, and I think some of my flares, maybe the pain was worse in my flare than it was to manage during post-op. But the satisfaction of knowing you have a diagnosis will take over everything, and it really is going to feel satisfying to just know you weren't going crazy. And yeah, post-op wit for anything is difficult, but it goes away. So just
Yeah. So,
remember that.
how are you feeling now? I mean, it's been several months. So, we're recording this just so everybody knows on February 16th. Today's the 16th, right? Yes.
Mhm.
February
Yeah.
16th. So, how are you feeling now?
So I'm going to start first with mentally. I feel very validated. I feel like every symptom that I experienced was so real. And I know that although this doesn't need to be proved to anyone, I proved to myself and my family and my friends that, I wasn't going crazy. I was in tune with my body and I listened to it. And that's an empowering feeling. It feels really good to come out on the other side, to know you weren't going loco.
It
So,
really is. It really
yeah.
is. Yeah.
Physically, I could not say anything better. For a couple months after surgery, I had pain with peeing and pooping, but that's just because of the sheer amount of endo I had on my bladder and colon.
Yeah.
And they told me it would get normal and go away, which it did. Uh, I have zero pain at all. Zero,
Wow.
zilch, nada. Sometimes when I'm on my period, I feel little twinges here and there, maybe a little upset stomach, but like night and day, nothing compared. I have shorter cycles. My last cycle was like, or my last period was like 5 days, 6 days. For me, that's magical. And one of the main things that's just absolutely crazy to me that I still haven't wrapped my head around 6 months later is I can eat all the foods that I want and nothing happens. I can eat dairy, I can eat gluten. I'm still mindful about what I eat, but I just knowing that I have endo, but those things aren't the end of the world when I eat them, and I can enjoy some ice cream and my stomach doesn't hurt, and it's incredible.
This makes me so happy. That is so awesome to hear because that's especially for what you do and that you're baking and cooking and things like that, that you can eat all those foods and you feel good. Plus, you had said you had stomach and digestion issues since you were 14. So this is
Yeah.
like a game changer for you.
Yeah. Even my family, sometimes they forget now and they'll be like, Skyler, you can't eat that. That's going to upset your stomach. And I'm like, no, I'm good now. I'll even
That's
be out ordering a coffee and I'm like ordering it with oat milk. And I realize I really don't have to do that if I don't want to. Yeah, I'm used to the taste, but now it doesn't upset my stomach. I can drink it
right.
if I want.
Right.
Yeah.
But with this is what's hard too. Then it's like this, like with endo and it's chronic. It's like, should you still avoid certain things? I don't know. I think to each person, I know some people are very rigid about it, but I
Hmm.
think you have to go based on how you feel and what works for you as an individual, right? I think
Exactly.
that's just, you have to navigate based on how you're feeling and make your decisions based off of that.
Exactly. And I think with anything, if we're a little too rigid, sometimes it has the opposite effect.
Yeah.
So, and more, if you're listening and you're extremely strict with your endo diet, that's incredible. And I
Yeah.
applaud you. That's amazing. For me personally, if I'm a little too rigid, then I go crazy on the opposite spectrum and will just eat all the bad things for a few weeks. So I find it's better to have some balance. If I'm craving something, I have it. I have it in moderation, but I try to just stay consistent with exercise. I do notice I feel incredible when I exercise and move my body. After surgery, I've been really consistent in trying to stretch and have flexibility and just keep everything, very flexible and moving in that area, especially because we know that endo can make things very tight. I also don't want too much scar tissue to form, so I'm just trying to be mindful about that. And I know things like that's inevitable, but if I can make it a little bit better, why not? And exercise is enjoyable to me, so yeah.
Yeah, I think those are really great points. Same for me. Like, I love exercise and I am pretty rigid on certain things on the diet. So, like, dairy and gluten are like a no. I'm allergic to dairy, so I can't, there's nothing I can do there.
Mhm.
But, like, for me, even after having surgery, gluten just, I still, like, my stomach will still just doesn't tolerate it. I'll get like swollen, I'll get like a rash on my stomach. So, like, some people it works, some people it doesn't. So,
Mhm.
but I will eat sugar, which I probably shouldn't, like,
Yeah.
so like we both said, you just got to see what works best for you as an
Exactly.
individual. There's not one right way for any of this right now until there's more information, more research. It's
Exactly. And that's such a good point to make too, because every endo story is so individual. And you can't compare your individual story to anyone else's because it can be vastly different.
mhm.
Uh, So yeah, just being really in tune with yourself and knowing what you can and can't do and can and can't handle, and that's individual to everyone. So if if you have to make personal decisions for yourself, that you can't maybe eat or consume certain things. Like for me, for example, alcohol, I noticed it still has a really big inflammatory effect on me. So that's something that I avoid. Not altogether. I do have a glass of wine because I find that that doesn't have me flare up, but I do get very swollen. I get a swollen face and swollen hands. And I do think that has to do with my endo and PCOS too. So I try to avoid it, but once in a while I do have one. But again, it's so individualized. Some people can, some people can't. So yeah, I think it's really important just to be realistic with yourself and be kind to yourself too. Yeah.
Yeah, that's a huge part of it because, like you even said, in that time period, you were questioning yourself in between the one doctor and then all your research and then potentially having surgery. You were like, do I really have it? Am I feeling okay? And that we're so hard on ourselves. We're so almost like programmed to believe that maybe we're making it up or it's not true. And it's, in your gut, in your intuition. And the other thing that I think is actually absolutely incredible about your story is you're young and you were able to figure out diagnosis, all of that, have an excision surgery before the age of 24. And I think the earlier that we can do this for people and get diagnosis, and the goal is to have one surgery. I mean, some people might have to have more. There's, but it's just that is going to set you up for just such a better path down the road because you were able to treat this sooner. And like you said, it was getting worse and worse and worse. It was progressing. And we know it's progressive disease. So I think that that's set you up for some really great success. And it makes me like just very happy to hear it. And I think the way that you've articulated everything and how you've explained your story is going to be so helpful for so many people who are listening and feeling certain ways about where they are in the beginning, middle, or end of their journey.
Yeah, thank you. I really, really hope so. Yeah, I hope everyone, is kind to themselves with their own journey. But I do hope that this is what will end up being the trend for diagnosis of endo. I am a very rare case of being able to be diagnosed and have excision surgery within a year of having symptoms. And I really hope that that's the future because of education that is available out there now. And I think it's only getting better. And I'm really excited to see the future of endo diagnosis because I think some really good things are coming for endo patients. So
I feel the same way, and I appreciate that optimism so much because as someone who's been through, been down this road for like over 20 years, I've seen there has been so much accomplishments and change. And even though sometimes it's very frustrating when you go to a doctor and they dismiss you when you know in your gut that this is probably what you have, but you were able to find an incredible doctor to help you, which is fantastic. So, is there anything else you want to tell everyone who's listening, or tips or tricks or anything before we wrap up?
I think I just want to reiterate that you know yourself and your body. You know what feels right and what feels wrong. So trust yourself. Find a community of trusted individuals. Maybe it's a friend, maybe it's a family member that you can talk to and you can share your symptoms with or your story with, and they can help you and be a good support system. I think it's really incredible too. Now that we have great education on endometriosis, we have so many different resources. So utilize those resources. Do really good research. I say that because tread lightly. There's some things out there that aren't really great resources, but you can go on Nancy's Nook and find some really, really great resources to look at. Find a doctor who's educated and willing to listen to you. And just surround yourself with people who support any decision you make because ultimately it's your body and you should fight for your own health and for your comfort.
Absolutely. Couldn't agree more. Thank you so much for chatting with us and sharing your story today. I so appreciate it, Skyler. I hope you have a great rest of your day.
Thank you so much, Melissa. You too.